Hey everyone, welcome back to the BioNexus Health Podcast series, Autism Uprooted. Today we will be traveling to the Middle East and speaking with a registered nurse of many years. So she is a medical professional who has 3 boys on the spectrum. And we are seeing some amazing improvements all the way from symptoms to seizures to diet and gut and, daily routine independence, academic achievements after starting the herbal protocols. So let's go ahead and speak to Samia on today's podcast.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
So hi Samia, how are you? Welcome today.
Hi, Doctor. Hi, how are you too? I'm fine. Thank you very much for your asking. I'm very fine. Thank you very much.
So how's the Middle East doing today? Is it cold, hot? Sorry, go ahead.
It's not cold. The weather change now. We become it's not so summer. The temperature become low, and we have windy environment. And the Qatar, we are from Qatar. Qatar now hosting the FIFA World Cup.
So that's right. So that's right. FIFA, yes, this year is in Qatar. Yes, yeah.
So everybody excited with that. So excited.
Yes, wonderful. So your boys are at school?
Yes, Doctora. I have twins boys in the school, yes. And small Salman also.
Yes, Salman went to school as well?
Everybody, yeah. But now they start vacation because the FIFA started in Sunday. So they try, all the school now shut down for the sport event.
Oh, for the World Cup. Oh, that is so awesome. All right. Wow, FIFA vacation. Fantastic. Good. Samia, you're a nurse. You're a mother of 7, right?
Yes.
Yes, God bless. And, it's so good to see you smile because I remember, when I first met you, there was a lot of stress, anxiety. But let's begin from the beginning, right? You have twins and one other son on the spectrum.
Yes.
Right. So can you tell me, and you're a nurse as well. So you have a good experience and medical background to be able to decide. So what made you decide to go with the all-natural herbal medicine protocol?
Thank you very much. The question is good. The doctor, I was struggling with all medical team and hospital long time to get the answer from them. One of the thing I was struggling from one hospital. Even I went to the Germany to try to send the kids for medical treatment. I may found outside that we'll get treatment for this spectrum. And I found it, everybody telling me you should live with this. There is no cure. It's something happening for your kids and you should accept it, live with it, try to live with it. And then I was telling, how come I live with it? I feel my children, they are suffering. There is some suffering around their symptom. They wake up in the night, they crying. Some children bang their head in the wall. They screaming. How come the children, they are not, they are good and we have to live with them? I know the hospital, since I'm working, I know the kids or people who get some paracetamol or something, they will sleep well, they become well, they don't have any symptom and they become relaxed. How come these children, they screaming all the time, they crying, they upset? Sometimes they giving them some risperidol. This treatment, it's like make them sedated and sleep. And I start thinking wisely, what's happening for these kids? What's happening? على طول gastroenteritis issue. They cannot sleep. Sleep apnea. They cannot eat well. Food problem for them. على طول bloating, gastric issue, bloating. So I am thinking, what is around them? Then and one day when I was in Germany, I take leave from my work, 3 months. I start making research and literature, and then I found a lot of mother who cure their children with natural treatment, and they said there is a hope in the world. Even I asked you in the first appointment,
Yes,
there is hope. There is hope. Then I start giving them some natural treatment. Immediately after 2 weeks, Doctora, after I read about diet and the diet issue, immediately I found my kids, they are not controlling their bowel all the time. This is one of the struggling, and we try to wash the house. They cannot understand where is the
wait,
toilet.
I'm sorry. Hold on. Wait, sorry. If I may interrupt. So I just want to summarize, so that people listening understand. So where you are in Qatar, at your hospital, you were told that, your 3 sons have autism and you have to live with it. There's no cure. You went to Germany a couple times, and one time, I mean, you actually took 3 months off work and you went to Germany. So you found some information on natural treatments, right? And then you heard about BioNexus.
Yes,
And
about the BioNexus, yeah.
Yes, okay.
And I found a lot of YouTube video about mother who said for her children survival rate become high. There is a children cure with BioNex, which is make me thinking. I said there is a cure. There is a cure. I really, Doctora. First of all, I will not forget that my country, Qatar, they support me a lot. Yani I cannot deny that. It's one of the best country around the world, really, in terms of supporting the special need. I will not deny that. This is one of the great achievement here. However, the disease itself is very complicated.
Yes.
It's a very complicated disease. And after I solved one puzzle, I found another puzzle. It's too much. During your protocol, Doctora, I found a great achievement for my kids.
I do remember meeting the very anxious, mother, Samia, at the first meeting. And actually, you are right. I do have other patients in your country, and everyone gets a lot of support from the system there. And, but unfortunately, autism is such a complex condition. And, while there is a lot of research on autism, there still remains to be more needs to be done, because in the West, here in the US, there is a lot more awareness, a lot more research, and, the research findings are actually put into medical use to help children on the spectrum. We look at underlying issues, but it hasn't translated to many countries. And I'm glad we have a few practitioners that help people all around the world. So yes, the Middle East people, the hospitals, the government, all the policies for helping children are absolutely top notch. Medical facilities are great, but it is the complexity of autism, right? Don't you agree?
Yes, I agree with you, Doctora.
Yeah.
I agree. Very complex disease. I learned from you, Doctora, that he's related many system in the body. So that is the reason it's very complex. I understand how it's complex, and that's the reason I really glad for BioNexus and you, Doctora, that supported me to find this puzzle. Whatever it's a cure for my kids, really, I'm very grateful for you. The children prognosis, the prognosis I'm seeing more and more every day. Alhamdulillah, alhamdulillah. Yes.
Good, good. I have, okay, that is, so let's start with the symptoms, right? So in the beginning, can you tell us what symptoms were the most bothersome for the boys? So you have twins, and then you have, like you mentioned in the beginning, then we have Salman.
Yes, my kids, the small one, he don't have a symptom at all. But the person who are really affected is the twins,
Okay.
who have majority of symptom, like like diarrhea, sometimes constipation. You found bowel issue and bowel symptom. If we move from the bowel, you can find gastric reflexes, which is never stop with the food whenever they eat
Oh,
anything.
gastric refluxes. Oh, I see.
Yes.
Okay. Yes.
Yeah, you see bloating all the time from GI. Whenever they eat small bread, whenever they eat by mistake sugar, we found them immediately they start vomiting and bloating continuously. It's not a vomiting, more you found the food in their mouth. They're not digesting well.
Okay, I see.
And it's like reflexes, like acid reflexes. And the second thing I found, like they are immunity very low. Immediately they get flu and they are very sick all the time. Starting from diarrhea, starting to upper respiratory infection. Immediately, continuously they have complaining, flu infection, symptom. You cannot know what is this symptom, but you found them immediately they have some reaction, something, and immunity very low.
Okay.
In the house, even we did not have flu in other brother, but you found them, they are sick all the time.
Okay.
Sleep, it's one of the big problem for the twins. They did not sleep at all. Some night I was suffering severe. I will go to the work, not sleeping at all for 2 days, 3 days. And really it's devastating when you try to, you're not having enough sleep as a mother. You got anxious, you become unable to think for this kid. And all the time, appetite is a big issue for them. They sometimes when they are in severe spectrum, they eat in everything, even from the floor, any garbage, anything. I was thinking, why they eating the wall or the paper in the floor? The mind, the mentality, they don't understand this is rubbish. They cannot recognize the difference between things. They might not give them clear dimension. So all this, it was very devastating for us as a family. I cannot tell you about the rashes, about the body rashes coming. You don't know what is this rashes for, like
The bad rashes on the body. Oh.
Yeah, skin rashes, which is a strange thing coming suddenly, and urine and changing in the urine also. When they pass urine in the night, you feel why they pass urine sometimes by themselves. If they sleep a little bit in anywhere, they pass urine. So many things. There is no control from their body in their organs. A lot repeated, also stereotyping behavior. Behavioral issue is another big concern. Screaming, shouting, crying all the time, running around the house in the midnight, which is, you don't know why they screaming, why they crying. School telling they are having behavioral issue, but what is the tending for this behavioral issue? Why they are having, did they have pain? If I give a doll or anything, Benadryl or paracetamol or Tylenol, you call it as a Tylenol,
Yes, yes.
they will be better. I am start thinking. It is allergic for something. If they have something, you cannot know. So
Yes,
that is the most.
how was their language, nonverbal, the boys?
Non-verbal, both, they are non-verbal, and they're not talking since they are 2 years. We lost the speech suddenly when they are 18 months. They at the beginning I remember they were telling mama, baba. Whenever we hold them, they have reaction, eye contact. It was there. Suddenly they become no eye contact at all. the skin and muscle become rigid. Whenever you try to hold them, they cannot control their muscle, they cannot control their body. It's very strange what's happening. And I remember one night while they are sleeping, he wake up, my son, one of the twins wake up, and then he climb in the bed, and suddenly he fall up from the bed. He's around
Oh my goodness.
1 year and 4 months. And then I said, how come he can fall from the bed? He cannot recognize it's dangerous that he will fall, he will climb. It's not at all in his age. Then I start thinking the growth and development, what's happening for my kids. And then in this age, the kids, they know the danger, they start knowing that.
That's right. Yeah.
Then when he fall down, I will start seeing why he fall down. I keep thinking. Here when I sent him to the nursery, they told me the kids have something. You have to examine with the physician.
Okay.
Here, when they reach in 2 years, almost 2 years, that time I recognized there is something. I went to the hospital and they told me the children are having autism.
Autism. So did he have did he hurt his head when he fell off the bed?
Yes, he had big
Head injury?
Yes,
Okay.
head
Oh,
injury.
okay.
And they don't it's I surprised, Dr. Dashore, how come he will fall from the bed 10 years and 8 months, or I remember in this age he cannot fall from the bed, even he will recognize the danger. That is the reason here I recognize there is some problem here they are having.
Right. So let's talk about when you started the herbal protocol. I remember we had appointments for all three boys, the twins, and then one more, one after another. So it was it was 3 protocols, and the protocols were different for each one, right?
Yes.
First, we did the labs. So did you find doing the labs helpful? How was the process of sending the labs? I'm in the United States, you're in the Middle East. So how was the process for you? I did the prescriptions. You're in your house. All of the test kits came to you, right? And then you were able to send them. So was the process smooth? Did you find any problems with getting the labs done?
Actually, yes, it was very good and smooth process. You have to know how to communicate. It's very important.
Mm-hmm.
You need to go to the shipping company, which is close to your house. And you need to understand the instruction in the box, If you don't know, I remember first blood test, I went to the lab beside our house. I asked him what the process, how can I do it? And he told me, do like this, just extract the urine in the second day. Because at the beginning you feel, what is this? How can I do it? But when you ask some laboratory people around you, which is here, we have a lot in agency, they have laboratory here in Qatar. They explain for you. Then the shipment, it will be very easy. Soon you get the specimen, immediately you collect it, you put it in the box with the ice, and then you cover very well, you fill the data and information, and you have to fill the date and time accurately. Make sure that you follow the instruction very well and need to know what is the instruction. And then you go to the shipment agency or organization, which is FedEx or whatever. Just tell them, take the test and try to explain for them. Immediately they will do it in the same time while you are there. Make sure everything will be accurate and to avoid any delay. So that is the reason. You have to at least organize what you're doing, plan it well, and then everything, it will be very smooth. And I did not find so far no challenge for me. Everything, it was going well.
Everything went well, right? Good. Yes. That's what I've been hearing, because we have laboratories in Europe, that coordinate for you all of the test kits. So we were able to do blood work, we did urine, we did stool testing, we did cheek swab, nasal swab. All of the testing was able to be done. Now, of course, all the tests that are available in the US cannot be done, like everything, but a lot of them we were able to do. And the best part is that you were sitting right at home. You didn't have to travel anywhere. Everything
No.
was done from nearby. Okay, yeah. And then you received completely customized protocols for each of your boys. You got the medicines at home, right? Everything was shipped to you. And so what progress did you start seeing one child at a time?
Actually, at the beginning, when I start, there is a reaction at the beginning, and it takes time for the body. When you start, so in your protocol already explain, don't give everything in one time. You have to start gradually. So
Correct.
I'm starting gradually, and I did not give everything in one time. So the kids itself, I noticed there is a reaction. Sometimes we can see some behavioral, some reaction like in the night they will not sleep well someday because protocol at the beginning. Now they are okay. I think the body adapt with the natural thing and they accept it.
Oh, wait.
Now
Okay. All right. Wait. So let me explain about this reaction that Samia is speaking about. When you first start treating
yes.
a child with, a lot of medical issues, because what happens is, there's no point in treating symptoms. Just like Samia explained, one of the options available is risperidol, right? Risperidol, risperidone, Risdone, there are many names. Now, that is an antipsychotic. So, I mean, autistic children are not schizophrenic, but, they are not psychotic, they're little kids with most of them with medical issues. So when we ran the labs for the boys, there was a lot of medical problems, a lot of infections. We saw a lot of digestive issues, right? Markers in the blood, viruses, yeast issues, mycotoxins. So all of these create a lot of symptoms in the body. And when you're trying to detox or when you're using herbal medicine to kill off some of the infections, then you have to go very slow. I actually have additional videos on this. So that's called as a detox response or a die-off response. Okay. So meaning when the bacteria are dying off. So that's what Samia is speaking about. If you look at BioNexus Health videos, die-off response, you can get additional information on that. So yes, gradual introduction, one herbal every few days. But keep in mind, getting this response is good news, which means which means that we are on the right track. So that is something I wanted to explain to people, Samia. So after this initial response, what improvements did you see?
I noticed better sleeping. They start improve in their sleep. They cannot before we cannot saw them sleeping like this. Now they are sleeping. In the school also they report that they are doing well in the school in terms of sitting, behavioral issue. It's gone now. It's not like before. Yes. Okay. Sometimes only with the flu or symptom they come back, but now not like severity before. There is no now less at all. Sometimes we did not see in them behavioral issue. It will be like rarely we saw them with the flu or something. We saw the other than that we improve in the sleeping. School improvement we notice from the school report. Children notice also. We notice also they want to speak. Jasim, for example, he want to talk. This is a very remarkable change happened for Jasim. always he cannot speak, but he trying to speak. So always he said, he cannot vocalize. And everything he will say, يعني, but he understand everything around the house. If you tell him switch off the light, open the door, close the door, just bring your bag, what I'm finding that he understand everything.
Fantastic improvement. Good. Good.
Yeah, before he's not understand anything, but now, mashallah, he's improving. He understand all the tasks. And sometimes when he go to school, he bring his shoes and he bring his dress and he waiting the routine, everything. I was surprising from him while he eating, very polite eating. He's sitting now in the kitchen. You never seen Jasmine shouting at all, not like before. Alhamdulillah. That is the thing, it's amazing. I saw in Jasim recently, and Khalifa as well also. Sometimes he have flu and action. As I tell before, Doctora, he loves sweets in between,
He
cheating in
loves
the
sweets. I know. Yeah, this kid is like, he has a big sweet tooth. Yes.
Jasim, no, not at all, Jasim.
Okay.
Jasim, mashallah. He very, he know the food that make him pain in his gastrics. So that reason he's avoiding everything.
So that's great. So Jassim is having improved personal awareness as well. Now he knows which food is good for him. And so both the boys, right, Jassim and Khalifa, they, how about their gut problems? Remember they had severe, you said, acid reflux and pain and digestive issues, diarrhea, constipation. I also remember you said you had to clean a lot because of the diarrhea.
Mm-hmm. Yes.
So how is that now? How is the gut?
Gut, wallah, it's improved, yeah, Doctor. I noticed now a lot of improvement in the gut in terms of bowel motion. It's become now not constipated like before. He have now also doing the bowel motion regularly. Yes, regularly, and he have also not complain like before from gastric reflexes. I doesn't disappear at all. He's become more asymptomatic in terms of reflexes. Even Khalifa, because I'm counting every day how many reflexes happening. I noticed Khalifa even less. Because before with all the food he have reflex.
Oh, okay.
And now he's become improve a lot. Even if he eats sometime by mistake the sweet, you found him reflex become less, which is alhamdulillah. And what the thing I love about Khalifa, he's not having like he have before, like he want to eat sugar too much, he want bread, he eat everything. Now he don't like to eat like Jasim. He start thinking and he realized this food is not good for him. So now he starts slowly avoiding. But some sweets he cannot avoid. So
That's right.
yeah, the other thing like bread, thing like milk. Before, if he saw milk in the table, he drink it quickly. But now he don't drink it at all. And he avoid the food that increasing his stomach issue.
That is
Which
fantastic.
Is
That is really good. I mean, the intelligence of the boys is actually coming out now, right? They are becoming good listeners. They are able to comprehend what you're saying, and they're able to help you out with the shoes and socks and getting ready and going to school. So that is, I'm really happy for that. I'm really happy.
Hopefully, inshallah, they improve and they start talking. This is the day we make a party in our house. We call everybody for celebration when they talk well and respond and learning to say mama. Khalifa starts saying mama, mama. He said, give me everything. He started knowing to say give me in Arabic, and they can say yes now, which is good. Alhamdulillah, alhamdulillah.
I'm really happy for you, Samia. I'm happy to hear, from very, very severe symptoms.
Yes.
They are, sleeping better, studying better, focusing, trying to speak, comprehension has improved. Are they playing
Yes,
more quietly? They're able to play. Very nice.
yeah, they play now. They start playing. Khalifa is very big fan in playing in football. So he bring the ball and he play in the football. He
Okay.
kick the ball, but he asked somebody to play with him. So he's very now understand, enjoyable, emotional stand coming back, which is very good, Doctora.
Oh, emotions are back. He's happy now.
Slowly,
That's
slowly
very
coming
nice.
back emotionally, yani enjoy, happy. When I come, I greet them. I said, Salam alaikum. They know, Alhamdulillah. Yani, this is the thing when you ask them greeting before they don't know. When I tell them, see you, bye, bye, they tell him bye. You know, this thing, responses is very good. When you see, you become happy as a mother, wallah.
Yes, yes.
Thank you very much for all the effort you're doing for the patient, Doctora. Thank you very much.
Absolutely, absolutely. It's my pleasure and my privilege to be able to help, people of all different cultures around the world. I mean, as a mother, I mean, I'm an autism mom, just like you are. And from one mother to another, we have to help each other. We have to understand
Yes, yes, of course.
what we go through. I mean, you've been through so much, my goodness, with the 3 boys, and I'm really happy that we are seeing so much progress. I know they have a lot of potential. We are seeing a lot of good improvements in them, and as we keep going up the protocol, there are 12 steps in the treatment of everything that we saw in the labs. So as we keep proceeding further and further, you will see additional improvements. I mean, comprehension, academic, gut issues, sleep, these are all extremely important for the body to be able to heal and for the brain to heal as well. Neurological healing needs to happen, and for that, the gut needs to be better. And for the gut to be better, as a mom, you have to look at the diet as well as herbal medicine. Now, were you aware that herbal medicine and natural supplements can give you so many improvements?
Yes, yeah. With the time, it takes time.
Yes, it does.
It takes time. I was, in the medical field, when we are working, we are in the nursing and medical field, you think everything happened quickly. Like you are very having a flu and you get an antibiotic, you become okay. That's all. And all the time I'm thinking like this perspective. I did not know that the herbal will cure you and will not damage your body. And I was thinking now, whenever my kids have a fever or temperature, flu when it's coming, I will not give. I actually went to the hospital, even here in Qatar, the physician tend to not give antibiotic too much now. They changed the practice because they found a lot of kids who are not needing antibiotic like before 5-6 years. So now a majority of people telling you come after 2 days, we will keep the child. They giving you just antihistamine or something, and antibiotic and to reduce the fever.
Yes.
Then that's the reason I start thinking, yes, let the fever, and I give some protein, and that's all, because it's good for the children to build their immunity, yani, not like before. So that's the reason we're not hurrying like before to the medical field. I started to realize herbal is very important. Herbal, it's one of the field of medicine that we don't know about it. And I don't have idea how it's worked before. But I saw the result after take time, but the family should wait and keep waiting the results. Inshallah, it will come. Everything is not a miracle. Doctora, we have to wait as a parent.
Absolutely, yes.
Yeah,
You
at
have
the
to work
end,
hard.
you will not. Yes, That's the reason I believe now in herbal, and I believe it's very good for children. Alhamdulillah, it's يعني something good. يعني we have to believe it.
Yes, yes, I couldn't agree more. Modern medicine is awesome when you need urgent attention, when you have symptoms that have to be taken care of. But when you have such a chronic illness with so many underlying issues, you need to be patient, and
Yes.
it is going to take time. I mean, there absolutely is no magic pill anywhere in the world. When you're when we are looking at biotoxin illness, pandas issues, it's autoimmune, auto-inflammatory. There is no one or two medicines that you go in. As you mentioned, children on the spectrum are given antipsychotic medication, like just to control the symptoms, and then it has a heavy sedative effect. So if it is acting as a sedative and it's dulling the senses, how are children supposed to learn?
I don't know.
So
actually.
so that doesn't really work. Now, one thing that you must have realized, and that's how I realized, with herbal medicine, because with Brian, we first went with very strong medicines because there was paralysis. We had to do what we had to do in the beginning, but just like you said again, that lot of medication can damage the body, can damage the gut. That's what we saw, and we eventually there was a lot of research, and we switched to completely herbal medicine, and it's very safe to use under proper guidance. And the progress that the gains that you see with herbal medicine, they stay.
Yes.
So right, no, it's not like you are going in for some sort of surgery for autism, or some sort of any other quick method which promises, you're going to see fantastic improvements in your kid, but then after a few months, that's it. You have a relapse, then you have to go back and get it done again and again. So that doesn't happen with herbal medicine. It's what I found was it's very steady progress, slow progress,
and sustainable.
Right.
And permanent. It's not like
and permanent.
Yes, I love it. Wallah, I love it. That's the reason when I found one symptom disappear, you said it will come back. No, it will not come back. That's the thing good about that. That's
yes. We had tried IVIG. We were looking at other invasive treatments, but then I was like, you know what? Not even any more needles will go into my child's body. This is enough. Nobody really knows what the heck they're doing. Everyone talks about extremely expensive treatments for autism. Come try this, come try that. I had enough, because we tried a lot, and we saw some improvements, again regression, some improvements. So we were doing like one step forward and 2 steps backwards. So it was a lot for my son's body, a lot for his mental health and self-confidence. So it just wasn't the path for us. So, but once we started herbals, God bless all of my teachers who I learned, herbal medicine from, and it helped my son so much. And then other mothers, started asking me, and then I said, okay, I'll make this part of my practice. And that's how, today we are helping in more than 85 countries, Samia. Isn't that great?
MashaAllah. Well, we really need to clap for you. Really, it's very great achievement.
Oh, thank you. No. It's not
a great achievement. It's we are really desperate, and the mother and parent who are with the spectrum, and we are really desperate. Some I know here in my country, some mother who are diagnosed recently, her children they keep crying, they upset, they don't know what they do.
Oh,
So
goodness.
I told them start with the diet at least. يعني, we become taking the advantage of what you're telling us.
Yes,
I
yes, of course.
I just tell them start with the diet, the child in a small age, be careful. I told them like this, but people still, their mind is still in the reality, in the shock.
Yes.
So they cannot accept from you. They feel stressed a lot. So that reason, when you told them that you have to change the diet, people still stress. They
Oh,
cannot.
absolutely. Yes. I
Uh,
understand. I should come visit you one day,
we
visit your
welcome.
hospital.
Yes, you come here in Qatar. We welcome you here. Qatar, very hospitality. This country, very generous, and we support you if you need anything. You are most welcome. We are, we can say our house for you, and we leave the house.
Oh, so sweet. That's so sweet.
Yes, you're welcome. Most welcome. You're most welcome.
I would love to travel to all the country. The reason why I said isn't that great is because it's so beautiful to meet people from so many different countries, all small countries, big countries, some countries I hadn't even heard of. Like the other day, I met a mom from Eritrea in Africa. That is like, and then I looked it up. It's a beautiful little country in Africa. So it is so great. It's such a blessing. And yeah, it's part of my bucket list, so to speak, to be able to visit all the countries that I'm helping people in, and
Of course, you're most welcome. Wallah, here in Middle East, we will welcome your joining here in Qatar, and even in any other country, you are welcome in Middle East. We wish to see you in here after you, and you will come to my twins. You saw them speech and talk.
oh, of course, yes, that would be wonderful. Yes,
Yeah,
yes.
inshallah. And this time, inshallah, we'll hope we see you, inshallah. Thank you very much, Doctora.
Absolutely. No, it's such a blessing to meet different people, and a mother's heart is the same. I mean, as an autism mom, what I felt, the shock, the depression, the hopelessness, the nights you spend crying, the nights you don't speak, not don't speak, the nights you don't sleep.
Yes.
And
yes.
we all go through the same thing. No matter what culture.
I'm agree with you. I'm agree
As
with
a
you.
mother, yeah.
Yes. So many people going with the same cycle, and they don't know how to get support, especially
Yes.
they cannot work, they cannot do anything, and they are in this cycle of stress. Hopefully, with a proper treatment and guidance, they will get in the future. I hope. I hope.
Yes, which is my biggest goal was to be able to offer online support,
Yes.
be able to organize everything so, mothers don't have to, I mean, everything falls on the mothers, the cooking, the cleaning, the looking after the family, going to the doctors, going to work, organizing, shopping, like, oh my gosh, there's so much pressure, so much stress on the moms, right? And yeah, and then having to travel. Okay, you have to go to this country and that country for this treatment, which may help your child with autism. I mean, I traveled to 15 different states in the United States for different specialists, and we traveled to 6 or 7 different countries, trying to get help. And that was, I know what the stress is, right? We had a child in a wheelchair, we had vomiting issues, we had special diet, going to so it is extremely challenging to travel with a child on the spectrum. If you don't want to medicate, of course you can always give psychotic medication, make them drowsy, make them zombies, and then take them wherever they want to go. But I didn't want to do that. I wanted him to be aware. I didn't want anything to dull his brain. It was very difficult to travel.
But good, now he's a big guy, mashallah.
Yes, thank you. Thank you. Yes, yes. So, one of the things that I always prayed for is to be able to help people, help the mothers, not having to leave the house. You sit at home, we will send you the tests, we will send you the medicines, and you just focus on the child.
Yes.
And enjoy the improvements that you see. So I think it has been working.
Yes, yeah. It's very important what you said, Doctora. It's really, we have to consider it, that the mother need help a lot. Mother, it's the,
Yes.
we are here in our society also, the mother, we start working. Working is another issue for the mother also. And you have to work and you left your house. So many things, there is so many challenges. So as you said, kids is very important, and hopefully the parent also, and both parents and especially the mother get help easily, and it will be approachable for her. So that reason, wallah, really, I feel that is very good protocol, and think what is going well, it will go well smoothly. And alhamdulillah, yani, I found with my husband and children, we are doing fine now. But we have to keep, as you said, following the protocol and guiding and instruction until we get eventually my kid talking, inshallah. But everything is so far good now. Improvement taking time, but improvement is there.
Wonderful, wonderful. Many blessings to you and your family.
Thank you very much, Doctora. Really, it's a great time to meet with you. Really, I'm very happy to support everybody else. Thank you very much.
Well, that brings us to the end of today's podcast. That was the wonderful mom of 7 with 3 on the spectrum. God bless her. From Qatar, Samia from Qatar. And she is so inspirational. I mean, she gives me strength as well. She's absolutely, a strong person, very determined mom as well, as you guys must have, realized during the podcast. So that brings us to the end of today's podcast. I am so happy you could join me, and I hope to see you back here on the next podcast with Autism Uprooted with BioNexus Health. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.